We have implemented an incident command structure. That means we have 12 individuals within certain categories of responsibility, meeting twice a day and communicating once a day to our internal constituents and externally. That we've covered a lot of groundwork in just the last few days. This command structure is 3 deep, so that if and when we should happen to get into a 24/7 cycle of crisis management, then we can allow people to get the adequate rest and attention to their personal needs. We have, as our guiding principles, instituted new procedures. The guiding principles meaning the health and safety of our workforce, and preserving the health and safety of our patients and visitors. So we have a new visitor policy. You can read through that. We have canceled many of the events that we normally would have had or normally would have occurred here at Stormont, to be consistent and in line with the direction from our state government of no more than 50 people, and trying to comply with the direction given by our president, and President Trump said he'd like to limit to 10. So we have tried our best to manage to 10. That's a little bit difficult inside a large organization such as this. It is really important, and we've stressed this over and over again, the call before you go. If a person has COVID-19-like symptoms and feels they need to be seen or receive some service, or to find out if they have COVID-19, it is really, really, really important to call ahead so that we can direct those people to the safest environment to get that test done. We are challenged by the limited availability of tests. That is a significant challenge for us. I am confident that everybody across the country is doing everything that can be done to address those challenges. But nonetheless, it is a frustration and an ongoing challenge. We, as part of our work in Incident Command, we've instituted what we call a labor pool policy, and as our services shift, as we contract certain services for especially those that are elective, non-emergent, that will free up a pool of our team members that can be used in areas where we may be running short. So that's the basic concept at this point. We've also have instituted a work from home policy. I think many of the community businesses have done that as well, and are trying to find ways that are efficient and effective, allowing our workforce to work at home. So I think we are seeing something that's happened kind of organically, and we've also given this direction, but the direction we've given is for 65-year-olds and those with the heart disease, lung disease, or diabetes to not solicit or not come for service unless it's emergent, unless it's urgent. We're trying our best to service those folks without an in-person visit, so we're standing up some telemedicine capability that we did not have, and actually we're seeing this happen organically. Many of those people are canceling their appointments, and we feel that's really appropriate as long as they don't actually have an emergent or urgent situation, and in that event we will see them and take care of them. We have that capacity. With that, maybe we'll take your questions.
So have you guys canceled all elective and non-emergent surgeries?
We have not taken that step yet.
Okay.
We are in the process of formulating the policy that will accomplish that. So that will be happening soon.
Okay. Can you talk about some of these new policies, like the screening people and limiting visitors?
Yeah. So, excuse me. So, our visitor policy has changed such that we can manage the number of people and making sure that everybody that comes in is screened with the travel questions and the symptom questions. We're following straight the KDHE guidelines verbatim, and so that we can limit the possibility of the virus entering the health system and exposing others.
And why is the screening part important when people walk in?
The screening identifies the risk, and so if you as a visitor have a high risk of having been exposed somewhere, then we want you not to come to visit.
Do you know how many people went through that drive-through service?
You know, I don't know, and that too is there was a little bit of confusion early. It is not meant to be come one, come all. It is meant to service those that meet the criteria for testing. Mm-hmm. And so I don't know the numbers.
Do you have a number of how many tests are available? I mean, I know you addressed
yeah. So no, we continually, we are following, again, verbatim, absolutely the strict guidelines that KDHE has set so that they can be prudent and good stewards of the tests they have. I'm not privy to know that number. I don't know.
Now that students won't be going to school, have you had any employees or anything that have needed to stay home?
Yeah, remarkably few, but that's going to be an ongoing challenge.
And what have you done for those?
That's a good question. We have had a policy in the past for inclement weather, or on a snow day we've been able to support the few people that couldn't find childcare by taking care of those kids here. The size of this issue is too big for us to offer anything like that.
And as far as elective surgeries go, are elective surgeries and sort of non-urgent appointments being rescheduled to deal with more virus-related concerns?
So, not to deal with more virus-related concerns, but to deal with virus-related concerns. So, those are being rescheduled because if they aren't urgent or emergent, then people need to stay home.
Okay, so that they themselves don't get infected?
Yes, yeah. So we're just responding to the need of the community at this point in time to limit interactions with each other.
And does that go for non-urgent appointments as well?
Yes, it
Not just
does.
surgeries? Okay.
Right. And the truth is that's happening kind of organically without our direction.
Mm-hmm.
Yeah.
And then for more urgent surgeries that were already scheduled or to take place, are those still taking place?
The urgent and emergent, we are absolutely here to take care of.
Okay. Is there sort of a priority list at this time?
There is a priority on surgeries published by the American College of Surgeons. You can look up their priorities around urgent and emergent if you want to. We can provide that for you, but we're going to follow that.